Well, hello everyone, this is Dr. Mike, Chua, physical therapist. Hey, today we've got a special guest. I am here at Family Medical here at Jackson. I'm here with Miss Deb Leggett. She's an amazing nurse practitioner. We always communicate through Facebook, but I told her, hey, I saw her 5th-year anniversary. So, Miss Deb, tell us first who you are, what do you do here at the Family Medical, and then what happened 5 years ago?
Well, we've been open 5 years. June 1st was our 5-year anniversary.
Wow.
We have, I'm a family nurse practitioner, been in Jackson for about 10 years now. This location here in Jackson has been 5 years. We have a Trezevant location that's been open, October will be 8 years.
Wow. Well, yeah. I remember we were talking about this, and then that was fast 5 years, right?
It was a long 5 years. It's been a long 5 years. Because if you think back 5 years ago, where were we 5 years ago? We're in the middle of a global pandemic. So we were building a clinic and opening a clinic in the middle of a global pandemic. So that's why I say it's been a long 5 years.
5 years.
Yes.
But I remember you were in a different location. Oh, same building, but you kind of moved or expanded. Am I correct?
We expanded, yes.
Yeah, wow.
And we moved over here. So this location here has been open for 5 years now.
How many providers do you have now here?
We have 5 full-time providers and 2 part-time providers.
Wow. Yeah.
And
then Trezevant is still up and running there.
Yes.
Do you still go there?
Yes. I split my time. Usually try to go down there about once every 2 weeks or so.
You're just like me, we travel, right?
Yes. Yes.
By the way, what are you are a nurse practitioner and everything, like, what are the different medical conditions that you see here? Or, I mean, not just medical, but what are the services that you provide here?
We see everything from birth on up into the end of life. We see hypertension, diabetes, high blood sugars. We see falls. We see lacerations. There's nothing we don't see. We do women's health, pediatrics, so we see all ages.
Does your team, your providers, they have different specialties that they see?
We're all family nurse practitioners, which means we can see the entire family. We can see any condition, and if it's something that's out of our scope, then we will refer them to a specialist.
Wow. I love that you, of course, family nurse practitioner, they see the whole family from birth to senior, from 0 to 99 or 101 or something like that. And then when they need something, they refer them to a specialist. So that's the beauty of having a primary care practice like here in Jackson. So Ms. Deb, we talked about, birth to 99 years old. So what is the most common condition that you're seeing in our community here in Jackson? And of course, what that you see here, is it like cough, COVID, pneumonia, falling, or what?
With our primary care, it's diabetes and hypertension and renal failure. With our urgent care walk-ins, which we do walk-ins and urgent care, is a lot of otitis media, ear infections for our children, strep throat, This time of the year with swimming and stuff, we see a lot of otitis externa, where they get the ear infections from swimming. And school physicals and well childs are a big thing that we're fixing to hit pretty hot and heavy with school starting back in August. So June, July, August, September, we're pretty full with school physicals.
Let's go dive in deep on what she was talking about, ear infection. Otitis media is somewhere in the middle, right? Otitis externa, somewhere in the external. So how can we prevent this from happening? I mean,
lots of times it's using earplugs, especially like if you're lake swimming in a pool that's not chlorinated well enough. A lot of kids get a lot of ear infections that way.
Is it, so you put some earplugs, is it cleaning after swimming? Is it important to you?
Yes, it is. And a lot of kids, it's just as they're maturing, their ear canals are very short, so it's kind of hard to prevent it as well.
That's so true, because it's getting longer. It used to be small or shorter, and then it could go out easily. Now they're getting bigger, and then it's swelling, and then you get that ear infection. So what are the common symptoms? Do they get some jaw pain too?
Sometimes it's just a sudden onset of ear pain, but if you've got a child that's very small, they may have a sudden sudden onset of a high fever, pulling at the ears. They may just have a fever and you don't know what's wrong with them because they're too young to tell you what's wrong with them.
So
but that's usually the first thing that we check is their ears.
Very good. Thank you for pointing it out. Okay, moms and dads, check out their kids. If they need check-up here. Oh, speaking of that, treatment. What do you do for treatment? Do you give them antibiotic? Ask them to clean their ears and flush it out, or what?
Lots of times it's an antibiotic if it's an ear infection, and it can be if it's just an external ear infection. We can usually just do ear drops.
That's good. Ear drops. Moisturize. If it's wet, you dry it. If it's moist, you. Say that again. If it's wet, you dry it. If it's dry, you moist it. Just basic ear infection control. You mentioned about, so we're done with the kids, right? We're not with the kids. My daughters are here. We want to the seniors, right? You talk about diabetes and hypertension. Yes. What is diabetes again?
Diabetes is where your body has the inability to break down sugars and carbs and stuff that we take in. In reference, we're referring to type 2 diabetes. We do see type 1, which is an autoimmune disease that children are born with. But usually as we age, our pancreas doesn't work as well as it used to, or if we take in large amounts of sugar and carbs, our body's not able to break it down. So we have a high prevalence of type 2 diabetes around here.
Why are you looking at me when you say type 2? I do have type 2, by the way.
Oh, okay.
I do know how we eat a lot. So.
Well, our diet and our culture, fast food, processed foods and stuff are some of the worst things that we can eat.
Culture. And our activities too is very important, because you can eat a lot, but if you burn it, see those people who work out, they eat a lot, but they burn it. So.
They burn it up, but a lot of screen time, scrolling, doing things like that, we don't get the activity or the exercise that we do.
Speaking of activity or screen time, what kind of speaking of screen time, what can we do to prevent this for our kids? Because we adults, we're really sedentary, right? But how about for our kids, We
want to get our kids out. We want them away from the computers, away from their cell phones, and get out and run and exercise and play. They need to have several hours a day of playtime. Less junk food. And I know that's hard with children, but, we need to provide them with more fruits and vegetables and less processed foods.
We really have to be intentional. When we were young, I'm sure Miss Deb and I are probably in the same age range. But when we were young, we didn't have the devices. We didn't have phones. So we were kind of, okay, we got to go out and play with our friends.
Yeah.
Now, they're always in their phone. I'm always on my phone, playing my PlayStation. And then we forget to be intentional. Now we have to be really intentional with our kids. Hey, have them go out. Hey, be active outside. And just be aware and intentional about it. So, you mentioned about, of course, we're talking about diabetes. Aside from the lifestyle modification, is there medication? You can't prescribe right now, but what are the common types that we give diabetic patients?
We have several medications, depending. We have some first-line agents that we'll use, but we really want to try to control it with diet and exercise, as well as medications. We use a lot of different medications, including injectables, and a lot of oral medications to control their blood sugar.
There you go. You also mentioned hypertension. Almost everyone is... has high blood pressure nowadays.
Yes, and a lot of it is familial. And again, it's our lifestyle, stress associated. Genetics play a big factor in hypertension. But, hypertension is a silent disease, and lots of times there are no symptoms.
That's so true. That's so true. It's called the silent killer.
Silent killer.
Because you don't know. Some are asymptomatic. They don't feel, okay, I'm fine, but you check their blood pressure, it's so elevated at 170, 180. I even have patients call Miss Deb's office. Hey, she's running at 180. She doesn't feel anything, and she'll be like, go ahead and take them to the ER. So it's very important that you check your blood pressure regularly, your heart rate, your oxygen, so simple vital signs. Ms. Deb, I know you're a very busy person. What is the plan for family medical clinic? You got...
we're constantly growing. We actually started this location, and then we took over the building next to us. So we've actually expanded. We went from 5 exam rooms, now we have 9.
Wow.
So we're just going to continue to to increase as the years go by.
How about the anniversary? You were going to have like a big party or something?
We did. We had a big party Monday.
There you go.
Had desserts and lunch and everything brought in. So yeah, we're hoping this next 5 years will be a little easier.
There you go. It will be. It could be worse, but it will be. Where can they find you? Is there any website or telephone number?
Yes, our telephone number is 731-300-2001. We have locations in Jackson and Trezevant, and we have a website. It's www.fmcjackson.com.
All right. Well, again, thank you very much, Ms. Deb. Appreciate you. Any last parting wisdom before we close?
Check the blood pressure, check the blood sugar. If you haven't seen your primary care doctor, go see your primary care doctor or nurse practitioner.
All right. Well, again, thank you very much, Ms. Deb. But before I let you go, always remember the word FAST, F-A-S-T, letter F. Find people that will bring out the best in you because you are the average of the 5 people you hang out with. So whoever you hang out with, that's going to be you. Today I hang out with Ms. Deb. I feel like, I think I want to bet my blood pressure check. Next letter is letter A, take action. All this stuff that we're doing is not going to do me good. It's not even going to do her good if you don't take action. Take action. Go to her website. Call her office. Hey, what the services that you provide? If you need hormone replacement, those injections or wellness checkup or whatever, go call them. Hey, what else are you providing? They actually even have an interpreter for Spanish-speaking people, right?
Yes, we do. We have 7 interpreters because we have a very diverse, and we have an Arabic interpreter, so we have a diverse culture here.
On a different note, I have a lot of pediatric cases referred by Tennessee Early Intervention, and we don't have an interpreter. And the state thinks I speak Spanish, but I think I need to talk to you offline on that. Because we have a lot of patients, and we're turning them down. The state is supposed to provide me a website, but to get the interpreter, but we haven't figured it out because they haven't given me the code. So
let's see if we can help you.
So where's the next letter? Next letter is letter S. Share and subscribe. The more shares, the better. So you got a Facebook. You got a Facebook page, right?
Yes.
Family Medical Jackson Clinic. Share that. The more shares, the better, because it may not be applicable to you, but it could be applicable to someone else. And last but not least, letter T is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, just like what Ms. Deb is doing, you're actually understanding more. Again, thank you very much. Be awesome, be great, be excellent, and we'll see you in the next episode of our Jerry Hab Show.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from